welcome. And for those of you in early intervention might remember that our First Lady did a Facebook Live with early intervention staff last summer. We are very pleased that she's joined us again. And we're very pleased that we have the support of her office as part of her Nurture New Jersey campaign. And so, First Lady, please welcome.
Okay, well, good morning, everyone. Susan, thank you for your patience and for your outstanding leadership as the State Director of the Department of Health's Early Intervention System. I want to begin by really saying thank you to every member of the early intervention workforce who, through your profound dedication, has found ways to support families throughout the COVID-19 pandemic. The work that you do to help infants, toddlers, and children overcome challenges and maximize their potential has really changed the trajectory of countless children's lives. But that's really only one part of the mission of early intervention. The second part, ensuring that families are informed, prepared, and able to help their child develop, as well as able to advocate on behalf of their child, has no doubt been a saving grace for the parents and families who you serve. As a mother of four, I understand that being a parent is really the hardest job out there, and making important decisions on behalf of your children can be incredibly difficult. Your work helping families to navigate early intervention services for their children is the lifeline that they need. And when I consider all that sets New Jersey apart from every other state in the nation, and there is a lot, our outstanding services and support for children who need early intervention is truly at the very top of the list. As many of you likely know, through our maternal health initiative, Nurture NJ, we are on a mission to transform New Jersey into the safest and most equitable state in the nation to deliver and raise a baby. When we began this work at the beginning of our first term, literally before we had even formed Nurture NJ, we learned what has to be proved, has proved to be the most essential understanding of New Jersey's Black maternal health crisis. The causes of this crisis are many. They are complex, they're interconnected, and their common origin, sadly, is institutional racism. To solve this crisis, we have taken a comprehensive and meticulous approach to understanding the crisis. We've made significant and often groundbreaking policy changes, and we've enlisted national experts to help us design our Nurture NJ maternal and infant health strategic plan. We've actually begun to implement many of its recommendations already, which is fabulous. Designed to make transformational change in a system that has historically failed our mothers and babies of color, this plan is our blueprint to make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. At its most fundamental level, the plan meets the specific needs of women in their local communities, where they live, work, worship, play. The recommendations range from increasing prenatal care and support for women of color to creating a groundbreaking maternal health research and innovation center so that our work can continue to grow, evolve, and inform itself over time. And most importantly, it makes broad reforms aimed at dismantling the structures that for generations have prevented women of color from living in environments that provide the resources needed to simply be healthy. The goal to reduce our maternal mortality rate by 50% over 5 years and eliminate the racial disparities in birth outcomes, it's going to require all sectors, health, education, business, government, academia, and more, to play an integral role. This is where all of you come in. The need for early intervention is clear, as we have seen an increase in referrals to the system to higher than pre-pandemic levels. The support you offer through early intervention will help our mothers and babies lead more stable, healthier lives, and will have innumerable ripple effects to the benefit of their families and the many communities across our state. As I said, our mission is to make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. And I am truly grateful to all of you for helping us work toward that reality. So again, thank you for being here and for joining us in our mission to transform New Jersey's maternal health landscape. I know today's panel will be incredibly informative. Thank you again for allowing me to be a part of today's program, albeit a little bit late. Thank you all.